So Counterstrain is a system of diagnosis and treatment that allows us to find where the inflammation's stuck in the body, in the fascial tissue of the body, by using surface tender points to point us to where the inflammation is stuck, and then we manually drain that inflammation out of the body. Some people have asked me, so you use needles to do this? And I suppose you could if you had like a tiny little micro needle to pull the inflammation out of the tissues, but we can also just do it manually, so no needles required. So because we're draining inflammation out of the tissues that it's stuck in, that inflammation does get dumped into the general lymphatic system, and then it's on its way out for 24 hours, maybe 48 hours after the treatment that we do. So we don't really even know what to expect until a couple of days have passed, as that inflammatory gunk leaves the tissue, and eventually you just pee it out. It gets filtered out through the kidneys. So when people are a bit sore, they kind of feel like a delayed onset muscle soreness kind of feeling potentially, but it doesn't have to happen, especially if people are hydrated well and they're active. The second window to kind of look for changes is during the next week, like around 5 days is the longest that I've heard for neurological integration to happen. So as that tissue, the function of whatever organ that we're working on kind of comes back online, the nervous system kind of figure out, oh, okay, so if that's going to move differently, then I have to do this. Or if we have access to this action again, I can turn off these other compensations over here. So there's an integration time that happens over the next week. And then the third window to look for changes after a Counterstrain session, the third window to look for changes in is the tissue healing window. So if you can imagine like this inflammatory gunk that's stuck in the tissue, it's not allowing fresh blood into the area because it's already full of inflammatory gunk. Then we drain the gunk out, and all of a sudden there's blood flow getting back into those tissues. But that doesn't mean, like, if that tissue's been not getting enough blood supply for 20 or 30 or 70 years, whatever it is, if it's been stuck for that long, it can take a little while for that tissue to kind of change and heal, because there's fresh blood getting in there, there's oxygen, there's nutrients that the body can use to heal that tissue. We've talked a little bit about the green wilted plant versus the brown crispy plant, and there are some things that even if we turn the blood flow back on, they won't necessarily fully come back. But the third window to look for changes after Counterstrain is around that 3-month mark, because that's the window that the body takes to heal the tissues.